Hello and welcome to HSM 410. Today we will be discussing application of healthcare ethics to informatics. So there are three learning objectives for today's class. We're going to be describing what ethics is and what bioethics is. And we're also going to discuss ethical decision making in health informatics, and then finally discuss the ethical and legal issues when it comes to health informatics. So, going straight into the first learning objectives. I want to kind of take a little bit of time to define some of the terms that you're going to hear as it relates to health, as it relates to ethics. So some of them, I'm going to talk about ethics in detail, but I'm just going to start with a couple of definitions for that, and then we go from there. I just wanted a um, quick mention that if you have taken HSM 430 or you are currently taking HSM 430, some of the things that I'm going to say here in terms of ethics are going to be things that you've heard before. That is because ethics has multiple applications. In this class, we're going to be discussing it as it relates to health informatics. In 430, we discussed it as it had to do with collaborative work, just to let you guys know. Right. So, what is ethics? So, there are a couple of definitions that we're going to go with. One says it's the study of right and wrong. The other one says it's a process of systematically examining varying viewpoints related to moral questions of right and wrong. And we have its rules and principles that govern right conduct. So, on the rules and principles, we're going to discuss in the second learning objectives, but it's basically all the things that getting considered when we, go into making what is considered to be a right decision based on the principle of ethics. So, we're going to talk about that a bit in the second learning objectives. So, we have talked about what is right or wrong, and we've talked about moral questions. So, how do we determine what is, right or wrong in terms of personal and also moral question? We have belief. Belief is seen as a personal values. And values is a personal beliefs about the what of a given idea, attitude, or custom and object. So, one's values can determine what their personal idea of what is right or wrong, right? And then morals is also personal beliefs of what is right or wrong. So, depending on the value that you place on something, that will determine whether you see that thing as being right or wrong. So, that is kind of the way that ethics, values, and morals just kind of coexist. But with ethics, we're kind of thinking on a bigger level than values or morals. Most people know about values and most people know about morals, but most people don't know what ethics is because ethics is more scholastic, and it really, really goes into detail in understanding, the things that fuel values and the things that fuel morals, as well as when it has to do with decision making. How do all of these things interplay? So, to dive in a bit deeper in what ethics is a generic term for various ways of understanding and examining the moral life. So, the ways that ethics does that is that it could be normative in the sense of presenting all the standards of what is right and what is good action, and trying to decide moral life based upon the standards of what is a good or bad action. It could also be descriptive in the sense that you're kind of reporting what people know and how they act, and using those to determine or make a case of whether a thing is right or is wrong based on that. It can also be explorative in the sense that it's analyzing the concepts of ethics and the method by which ethical decisions are being made. So those are the different ways that you can look at ethics. So it also brings us to the question about how does legality come into play when we're talking about ethics. Can something be ethical yet be illegal? And the other way, can something be unethical and yet be legal? The answer is absolutely correct. The reason is because what becomes legal or what becomes a crime is not always based off on whether it is ethical or not. Some of the decisions that go into lawmaking are not based on ethics. So meaning that something can be legal and yet not be ethical. So it's a way of really looking at it. And when we're studying, examining the moral life, or what is right or what is wrong, ethics looks at it beyond whether something is legal or not when it's examining that. So bioethics, we talked about ethics all this while. Let's talk about bioethics. So bioethics is kind of focused on the study and formulation of healthcare ethics. So that's where we are in the sense, and it looks at it by looking at the nature of humans as living, thinking beings, and also considers the purpose and functions of a healthcare system in human society. How that works, how does that interact with people's values and people's morals, both as the person who is receiving care and as the person who is providing care. There's also an increasing cultural awareness of human beings, because we do know that people in their interaction with the healthcare system, their culture comes to play. Both whether you're a patient or a healthcare provider, you have your whole social values, your whole cultural awareness that comes into it. So bioethics also looks at that, and we have kind of move towards increasing awareness about cultural competence in healthcare as a way of kind of improving service provision for people. So, bioethics takes on relevant ethical problems experienced by healthcare providers in how they are providing care, whether it be to individuals or whether it's in population groups. So, other terms to kind of get familiar with when as relates to ethics is value ethics. So, value ethics approach emphasizes the virtuous character of an individual, the one who is making the choice. So, all of this time I've been talking about ethics have kind of focused on the action itself, but value ethics goes beyond just looking at the action. It goes, looking at who is the person who is making these choices, and in a way kind of looks at relates to the character traits of the person who is making the choices in terms of whether they are considered trustworthy or not. So, virtue ethics is heavily influenced by culture, which is another reason why understanding cultural competence really comes into play, and the reason why it's important to understand cultural competence is that what one person considers to be virtuous in one culture may not be so in another culture. So that is all the things that come in when we're talking about virtue ethics. So, under virtue ethics, moral events composed of four elements. We're looking at the agent, which is the person who is making the choices, the action itself, the circumstances that is surrounding the actions, as well as the consequences of whatever decision that is going to be made. So, that is how virtue ethics does all of that in considering decision making. So, ethical reasoning using virtue ethics really tries to incorporate a wide range of possible actions and consequences and societal values when coming up with a decision about, okay, should we do this? Is this right? Is this wrong? It does it in a really great way. And then we have care ethics. So with care ethics is kind of there's a lot of emphasis on responsiveness to the needs of others. That is what drives the provision of care, whether you're preventing harm or you're maintaining relationships. Care ethics really, really places a lot of emphasis on the need to provide care to people and to prevent harm, and as well as maintaining relationships. So there's a lot of focus on the needs of others and the responsibility that one has to meet those needs. So there's a lot that is based on relationships with both the patient as well as your fellow healthcare worker, and having a caring attitude towards others. And this ethics of care really emphasizes personal parts in the interdependence relationship and how that affects decision making. And for those who approach healthcare provision from care ethics, they're a lot less guided by rules. Not to say that they don't, follow the rules, but in a situation whereby they have to weigh between what they consider ethical and what they consider legal, they're very likely going to move with what they consider ethical versus that, even if it's considered illegal. So that's that for the first learning objective. So we get into decision making. I've talked a lot about decision making, so now let's get right into it. So when we talk about ethical decision making, some of the thing that comes up a lot is what we call ethical dilemma. So, what is ethical dilemma? They arise when there are moral issues that raises question of, what do we do? And there is no defined, simple answer to it. It's not defined by rule or by fact or by authoritative view. Let's just, for example, let's say there is a problem and there are three possible solutions to it. uh, A, solution A and solution B are both things that could be considered ethical as well as legal, while solution C could be considered ethical but would be illegal. It's like, so which decision do you take? For some people, solution C is automatically eliminated because they don't want to go against the law. But for some people, they want to keep C because for them you have to also consider that. But even whether you're keeping C or you're keeping or not, you still have to consider among the three or the two, which do you go by. Some of the times it's not very easy. It's not very simple to decide, okay, let's go with A or let's go with B or let's go with C, even though we know that C is illegal and may bring up a couple of problems. So ethical dilemma occur when some evidence indicates that an action is morally right, while there also evidence that indicate that the action is morally wrong, or there may be a situation where the decision is not conclusive on either way. It could also mean that the person believes that on their own moral grounds or their own moral beliefs, a personal beliefs that they cannot commit an act, even if it is ethical or even if it is legal. An example would be, let's just for example, a patient's assisted suicide. There are, physicians that will never euthanize somebody, even if it is legal, because for them it goes against their own moral grounds, it goes against their own personal beliefs. In a situation like that, that kind of presents an ethical dilemma, because suicide in that case, physician assisted suicide in this case, is not illegal. And when you consider the need of the person who's asking for it is also helpful to them, but then what do you do? Just do you say, I'm not going to do it just because on my own part I consider it to be an immoral thing, I don't believe people should kill themselves or stuff like that? Should I therefore, based upon my personal beliefs, refuse to do that, or should I overlook my personal beliefs and go ahead and do that? So those are the different ways that ethical dilemma can occur. And but either way, you still have to make decisions as a healthcare provider, and some of the decisions, whether it is straightforward, let's do the A or let's do B, you still have to kind of make decisions. It is a lot harder to do that in a situation of ethical dilemma, but whether it is or not, you still have to make decisions from an ethical basis as a healthcare professional. So some of the things that we consider is kind of looking at some things like what option provides the most good and the least harm, which option best represents respects the right of all who are affected, and which option best treats people equally and fairly, which options best serve the community as a whole or common good. And this is for people who care about this, which option leads me to act as the kind of person I want to be, a virtuous person. So these are all the questions that will come up when making those ethical decisions. And a lot of these questions that I just brought up are based off of what we call ethical principles. And we have about six of them. I think there's eight, but this is the six that really comes up a lot. You have autonomy, that says all human beings have the right to decide what's best for them. We have beneficence. Healthcare providers must actively secure the well-being of the patient. We have maleficence. We know there's non-maleficence, which means do no wrong. We have justice. Healthcare professionals being responsible to protect patients and vulnerable population. We have fidelity, being able to follow through in providing care. An example, non-abandonment of patients. If you are the physician who's been asked to provide this physician assisted suicide, but for you it's something that goes against your moral standing. Kind of the principle of fidelity means that you're not just going to leave the patient and like, I don't know, I'm not going to be involved in this, but you can actually transfer that patient to somebody else who doesn't have the same ethical dilemma for them. So that's what that means. And you have veracity, which is truth telling. Healthcare professionals should not lie or intentionally or maliciously deceive patients or family. So that's where full disclosure comes in. So, but we still have the question of who does what, something that really comes up. Healthcare services used to be provided in person, like you come to a healthcare provider's office, you sit down across them and you tell them what's going on with you, and then they give you medical advice or health advice based upon what you tell them. With technology, you're kind of not in that domain anymore. A lot of health services that were provided by clinicians or healthcare professionals are now being achieved by, apps on smartphones or wearable devices. Like we have the Apple Health that measures high blood rates and can even call emergency services when it detects that you took a hard fall. And then you also have the situation whereby healthcare providers are increasingly using social media with their patients, and they're doing that in sharing health education, which kind of brings up a lot of issues and concerns, ethical concerns. One would be in terms of privacy, just how much information is a patient consenting to sharing, or even if they didn't consent to it, or they did consent to it, just how much are they comfortable with what you're sharing. And then you have the issue of confidentiality, and then data sharing challenges that all come up. And these are all the challenges that health technology has kind of introduced. So also consider that patients and healthcare providers no longer have to be in the same place. That kind of takes away some quality interaction to a degree. It doesn't completely all take it off, but it does take away that personal knowing of the person in the way that when for example, you're doing health education online, you are very, very likely going to be providing health information to far more people than you think you're doing. And these people you may never know. They probably are not interacting with your content in the sense of leaving a comment or liking it or anything. They just watch it and then they go away. But they are still taking information out from what you're sharing. So that brings up that issue about it. So, but then it does bring up a couple of questions that how does one deal with licensing issues if electronic consultation take place across a state line? Do you bill somebody for living in a different state from where you are? Is that an additional cost because you're providing care to someone who lives in a different place and probably pays a different tax there? And then you have the ethical issues that come in with data mining, because let's be honest. When they bring all of this fine print, all of this, those, especially those apps or something that you're signing up and you have this long list of things that they're telling you to read and consent to. Most of us don't read that. We don't read it. We just, sign it off and go away. So that, brings up the question of does public good, which is something that comes from the data mining and data collection, does it outweigh personals, individuals' interests? Because you are consenting to the use of your data, but it's not really a informed consent because you don't know what it is that you're consenting to. For the most part, you just sign it off just to move on to other things. So it does bring up some ethical concerns about that. So, like I said, patients' increasing use of internet for health information does prompt other ethical issues, like who is responsible if a patient is harmed as a result of using, an online health advice. Remember, this online health advice are rarely ever tailored to a particular patient, so many people are listening to it, and most people may not be the ideal audience for it. So it's important to realize that, these standards for ethical development of health related internet sites are voluntary. There's no law or a person who is like an overseer that's perusing these sites and deciding okay, this is okay and this requires further attention, or there's some kind of security alerts and stuff like that. Those things are not there. There are a couple of things to show that a website is has been reviewed and is trustworthy, like this codes here, but most people don't even know about it, to look out for it. Most people just, so long as it's online, they just take it, to mean, okay, this makes sense. It doesn't necessarily mean so. And also because, healthcare providers cannot fully control which information the patients are assessing and how they perceive that to be, because you may think, you may have all the education you have, and you may give information to the best of your knowledge, and taking into account all the different ways that it could be perceived, but there's an issue of low health literacy when it has to do with online health education, and there's only so much you as a healthcare provider can control. You don't know your patients, in this case patients, because they're taking advice from you, and you don't know whether what they understood you to have said is actually what it is that you said. So this all of these do bring up issues. So let's go to the third learning objectives, where we're going to discuss ethical issues with health informatics. So increasingly, there's a lot of technology that is being used in health services. You have smartphones, that are interacting with patients' status and behaviors. You have wearable technology, and the Apple Watch and stuff. And then you have the Google Glass. You have social media like TikTok and stuff. There's a lot of health services to a degree that is going on in this sites, and then you have mobile devices that are being used by healthcare providers. So all of these are all the different ways in which technology is interfacing with healthcare. So how do we apply ethics to healthcare, to health informatics? So one thing that is very important for healthcare providers to know is that they have to make ethical decisions in all areas of practice, and they need, in order to do that, they need to understand what ethical approach is and how it is used. Also, the use of a lot of expert systems, for example, telemonitoring, decision support tools, evidence-based practice, or AI, in healthcare does provide a lot of challenges, both for healthcare providers and the patients. And there's a lot of ethical consideration that needs to go into the use of these tools. You kind of need to think about who is using those tools, how are they using it, and how does that get tampered with clinical judgment. Are the tools enhancing clinical judgment, or are they kind of making it worse? Are people over relying on them and therefore not taking the time to, kind of consider how they may be impacting ethical considerations? So, in order to make ethical decisions with informatic technology, we have to be informatics competent. We need to be able to kind of have processes and models to diagnose and treat our patients in practice, and we need to be able to apply those models in analysis and synthesis of ethical dilemma. So, in in theory, bioethics should be able to, collect, manipulate, and all the good stuff, databases that is related to ethical issues, so that this way they're able to do some effective reasoning, applying it to various ethical dilemma, and coming up with, ethical decisions. So the question is, should AI be used to resolve ethical dilemma? So this paper, was argued quite against it, and feels that some of the things that is required to make good ethical decisions, such as moral agency, robust interaction, so act in a moral way, in moral ways, even in unprecedented circumstances, and the ability to take responsibility for one's actions, are something that is outside AI, something that AIs can't do, and therefore those ethical decisions need to remain in the domains of human. So there's some of the legal aspects of health informatics. We have the High Tech Act, and some of the ways that it kind of worked when it comes to health technologies. An example would be the way that it enhanced HIPAA by requiring the disclosure of data breaches, and also with the way that it kind of introduced meaningful use with healthcare physicians, kind of to get them to have more people using electronic health data. And one of the ways is by incentivizing them some kind of a payment for physicians, healthcare providers, and hospitals that are using health records. So question is whether it's actually serving that goal. So one study says that there is, weak evidence that meaningful use is improving uptake. Another study says that, yeah, it is actually doing that, and it's all down to high tech. But, it all really depends on who it is that is making the case for it. So some of the other problems that come into with health informatics is that medical devices are regulated by FDA, and these are devices that are designed for the diagnosis of diseases and other conditions. However, most apps are not considered medical devices, and so unless an app is an accessory to regulated medical device, it's not under FDA oversight. So that does bring a couple of things. So other new challenges to look at, as it has to do with health ethics, is that we need, as healthcare providers, to understand how important health decisions are. And in an ideal world, healthcare providers are not going to be affected by conflicting loyalties, and they're able to make judicious and ethical decisions. That's not quite happening in that way. Some of the times you have a split second to make a decision about what is ethical and what is not, and you may not, if you're online, your life, it may be quite difficult to achieve. And then, but we still have to have a solid foundation for ethical decision making and be able to practice it consistently. Especially when it has to do with social media use, you have to be very understand some of the breach of confidentiality of patient information and what ramification that could have. You need to be able to check your organizational for what the social media policies are. And that's how it is for today. If you have any question, please remember to post it in the Q&A board, and I can explain anything that you didn't understand. So you have a lovely day. Bye.